because of COVID-19, very important restrictions, very important terms and conditions to perform, very innovative ways to perform Umrah safely. And we know that we passed, alhamdulillah, these few days and all successfully. And also during Hajj season, it was very successful performing the Hajj without any detection or any registry of any COVID-19 condition.
What are the rules at present?
Ministry of Health and the other agencies are ensuring that pilgrims are going to be selected or visitors or those who are going to perform Umrah are selected with criteria so that those with risk in the risk group are not going to be in the priority list. Second, the control over number and flow of people entering into the Haram to perform Umrah. The distances between people. There are going to be also health leaders who will participate in and accompany each group. Not to mention that facial masks will be there throughout the performance.
What is the hospital capacity in Mecca and Medina to accommodate any breakouts should they happen?
In general, around the kingdom, the capacity of beds, whether these are regular beds or isolation beds or intensive care beds, increased. This is including the holy cities. Just to give an example, the intensive care units, which are the most challenging ones, increased almost to the amount of 50% or the percentage of 50% increment in the availability of ICU beds. And we never, alhamdulillah, experienced any touch to the maximum or saturation level at any of our cities or regions in the kingdom since the beginning of this pandemic till now.
Your cases at present are significantly lower after having one of the highest incidents in the region, but you do have some 336,000 cases and almost 5,000 total deaths. So how would you rate the kingdom's way of coping with this, and how did you manage to finally control the outbreak?
There are more than 230 centers receiving those who are having any symptoms, and there are 21 drive-thrus and many other places that receive people symptomatic, asymptomatic, regardless of their situation, regardless of any nationalities or residencies condition. They can come and free of charge do the testing, and also free of charge if diagnosed to be positive will be treated. There are 3 national centers looking at all these results and do simulations and do predictions. So we are not only reacting to this situation, but also proactively reacting to it.
We have sadly learned that no country should become complacent. We are seeing a second wave blighting Europe and other places around the world. What are your plans should a second wave hit Saudi Arabia?
We deeply analyze all the available data to ensure that we know what's going to be in front of us. We passed the first 70 to 80 days of this pandemic with restrictions, early interventions, very strict interventions to ensure that we are suppressing the curve, and we return back to our life, but with new normals. And this new normal is very important. We opened multiple activities, but we have more than 100 protocols to ensure that people are returning social or sectoral with appropriate new behaviors and new norms.
The race for a vaccine is on, of course. What is the kingdom's plan for the acquisition of a vaccine and indeed the distribution of a vaccine within Saudi Arabia?
We are part of the Act A, the Access to COVID-19 Tools Accelerator, where we are part of the founding countries of this accelerator. The kingdom participated with $500 million US dollars to support the international efforts There are many important agencies, Gavi, the World Bank, the Global Fund, with the WHO are